Hi, everyone. My name is David Putrino. I'm the Director of Rehabilitation Innovation for the Mount Sinai Health System, and I'm an Associate Professor of Rehabilitation and Human Performance at the Icahn School of Medicine at Mount Sinai. So, individuals who are experiencing moderate to severe disability after their stroke do have a lot of options open for them in terms of rehabilitation. It is a mission of the Abilities Research Center at Mount Sinai, which is one of my clinical centers, to really get the message across to individuals living with chronic neurological disability that there is always something that can be done, that no one should be told that this is as much as you're going to recover or there is nothing that we can do for you. We offer a range of different technological rehabilitation options, such as exoskeletal robotic rehabilitation, non-invasive brain stimulation for speech therapy, as well as for movement recovery. And we also offer very intensive rehabilitation programs that involve hours of rehabilitation per day, multiple days of the week, in order to assist individuals who are experiencing severe disability after their stroke to up-level their skill set. So there is always something that can be done, but it does take a lot of time and effort to make the necessary improvements. So currently there is a lot of research that is focused on improving rehabilitation options for individuals with stroke. The research is broad and encompasses things like using brain stimulation technologies, such as vagus nerve stimulation, where the device is actually implanted inside of the body, and pairing that brain stimulation with intensive physical rehabilitation to improve outcomes. We're currently researching using non-invasive brain stimulation to improve outcomes in people with aphasia, which is difficulty speaking after a stroke. And we're also, in the post-pandemic era, we're also trying to understand how to deliver services to people in their home. And so we are investigating a lot of tele-rehabilitation technologies that will allow us to bring stroke rehabilitation to the individual who's recovering from the stroke, as opposed to having to necessitate bringing someone who has difficulties and challenges with transportation into the hospital. So in the current setting, there is not always the best of collaboration between different departments when it comes to managing stroke. We often talk about healthcare systems and healthcare being siloed, meaning that many departments don't speak to one another when trying to manage the best possible care for a patient. I'm very proud to say that at Mount Sinai, we try to be as collaborative as possible with other departments. And I think that our collaboration with our neurosurgical team, the Department of Neurosurgery, is really special. We have many investigators and clinicians in the rehabilitation department that are constantly collaborating both on research and clinical matters with the neurosurgical department. And one of the culminations of those collaborations has been to focus on providing one of our patients with an implantable vagus nerve stimulator, which we hope will enhance the impact of rehabilitation when paired together. So the idea that stimulating the nervous system, priming it for a rehabilitation response, and then providing the rehabilitation may be a very, very effective way of improving outcomes in people who are recovering from a stroke. So a stroke is a condition that occurs when the brain loses its access to oxygenated blood. Now, this can happen as a result of a blockage in an artery, or it can happen as a result of an artery actually breaking and causing a bleed within the brain. And when either of those events occur, typically what happens is brain cells that were supplied by that artery start to weaken and then ultimately die because they've been deprived of oxygen. So during a stroke, what is really happening is certain areas of your brain are being deprived of oxygen and the cells are being damaged. How this can manifest is in many different ways. People may experience weakness, i.e., they might have difficulty walking, or they might have difficulty moving their arms. They can often experience difficulty with speech, so experiencing slurring of the speech, difficulty finding words, difficulty putting sentences together. And also, some people can experience things like a facial droop. So you may notice that one side of their face is starting to droop noticeably. Also, people will experience headaches and nausea and dizziness and disorientation. So there are many different symptoms, but I think the most important part of recognizing a stroke is that these symptoms are sudden onset. So, an individual will be fine one moment, and then the next moment, their face is drooping, they're having trouble finding their balance, they're not able to lift their arm, for instance, or move their leg. It typically will affect one side, although in some cases it can affect both sides of the body. But if you notice any of these symptoms, the most important thing you can do is call 911 or whatever the emergency code is in your area, and make sure that emergency professionals get to this individual, because time is of the essence. We often say in the field of stroke and stroke rehabilitation that time is brain. The longer you take to get someone to the hospital, the more likely that permanent damage can occur. Once we get someone to the hospital, we can intervene. We can do things like break up the clot that is causing the problem or repair the vessel that has torn. But every moment they're away from a hospital is one more moment that damage is occurring.